to share with you everything that is important to know about breast augmentation, selection, implants, and just all the nuances that are really, really important. When considering breast augmentation, there are a number of really important factors that need to be considered. I really look at the state-of-the-art breast augmentation as including the following factors. The first is very good informed consent. So you have to be well informed about the procedure, the details of the procedure, the potential risks and complications, anticipated follow-up, recovery issues, and how to deal with just the weekend that you're in store for directly after surgery. The next is when you come into our practice, the first thing after meeting our team is that you will experience 3D imaging and simulation. So we use Canfield Vectra, and it is the single best way to actually navigate implant selection. And you can actually see the potential range of outcomes before surgery. So it's really, really important and significant. When we look at implant selection, there's a specific range that fits inside the breast and body. We call it tissue-based planning. The important factor of that planning is mainly the width of the breast. The key thing for me as a plastic surgeon, I want to match the width of your breast to the width of the implant. When we do that, then we can adjust the projection or profile of the implant to fill the space, and that will give you the best kind of natural proportional outcome possible. About 30% of the breast surgery I do is revisional from other plastic surgeons. Usually that's the base width of the breast has been compromised, usually with too big of an implant. The soft tissue skin can't hold up the weight of the implant, so the lower skin bottoms out or stretches, gets what we call a lower pole stretch. And so it's vitally important that the tissues are matched to the implant characteristics, particularly the width of the breast. So the planning is really critical with this operation. Second thing is the actual performance of the surgery is also vitally important. So done somewhere between 8,000 and 9,000 breast augmentations in the last 30 years, and we do around 300 or so breast augmentations a year in that range. And you develop a very good, successful, efficient routine. The key things to breast augmentation are to go through a small 1-inch fold or crease incision in the base of the breast. All other incisions create more complications. There's really no reason to go any other route, and I always tease patients, you really don't see that incision unless you grab your breast and lift it up. So it's just really blends into the crease and fold over time. But it allows us access, so we've modified some lights and instruments to actually create the pocket without one drop of blood. So the first critical thing is to make the surgical pocket to perfectly fit the width of the implant with no bleeding. When we accomplish that, there's much less swelling, bruising, pain, recovery. And the next important aspect of breast augmentation is a fast track recovery. So at the time of surgery, we block your breast with a long-acting numbing medicine. And so we basically infiltrate that into, or inject that into the skin, soft tissue, some of the nerves around the breast, including the muscle. So we actually paralyze the muscle a little bit because there's that pressure feeling afterwards that you feel that we'll get into in just a minute. So the breast is very numb, so post-operatively there's very minimal incisional pain. It's really more of a pressure feeling of the chest and the muscle kind of contracting into the implant. Most patients can recover within 24 to 48 hours without narcotics. So there's some patients that do still require narcotics, but the vast majority of patients can recover very well, get back to normal activity super quickly. And so that really is the state of the art where we are today.